Okay, I just had to take me a personal break. I don't know if I've mentioned before that I work in hospice, and as a part of my job responsibility, it is I have to send CNAs, nurses, chaplains, social workers to my patients' homes and or facilities. If a hospice patient is at home, assisted living, nursing home, homeless shelter, wherever they're at is where we provide their care. So right now it is COVID season, and my job is to screen the facilities and or homes or whatever before I send a CNA, social worker, chaplain, nurse out there. Mind you, regardless of their diagnosis, we're still going to care for them. They're still entitled to care. They're still entitled to dignity, respect, all of the above. That's unwavering. We're not even debating that. But what absolutely pisses me off, and this has happened a couple of times, just this one just really got under my skin. I don't like it when the family, caregiver, facility, nurse, whoever is evasive with answering questions, screening questions about COVID positive patients. Mind you, I don't need to know if Miss Mary down the hall in room 2A has a chipped nail, a sprained toe, or a UTI. However, I do need to know if anybody within the home and or facility has been exposed, has any signs or symptoms, test results about COVID. I need to know if they have shortness of breath, tight chest, diarrhea, dry cough, vomiting, temperature, and the list goes on and on. They've been out of the country. They've been exposed, whatever. I need to know that about staff members. I need to know that about employees. Not so that we can discriminate and or not go, so we can protect ourselves on our end, okay? What if my nurse is a recovering breast cancer patient? What if my nurse is pregnant? You know, I could dispatch or send out another nurse that has A1 health. Mind you, this fucking virus has no discrimination. It takes children, old people, healthy, track runners, everybody. But I'm just saying, when I ask this series of screening questions and they're like, come on, man. Like, I know this is your loved one, but I'm sending my loved one out there as well. It's a coworker, but we still have a relationship, okay? They still have a family to protect. They potentially come back into the office. Their shoes could be infected, their clothing, whatever. We don't really know how it transmits 110%. We got some really good ideas. We don't have vaccines. We got PPE, y'all. That's what we got right now. Okay, let me know so I can properly inform this nurse that's coming out. Your patient is still going to get care, comfort, everything that's needed. We treat cancer, HIV, we treat everything. If they're on hospice and they have 6 months or less to live, we're going to give them comfort, support, dignity, respect, all of the above. But I need you to be forthcoming with what's going on. I just had an RN call me when I asked them some screening questions. Say, did the patient have any, because the patient just passed, did the patient have any signs or symptoms? He goes, what are signs and symptoms? I want you to shut the whole hell up, because you're an RN, which means you went to school for a very long time. Answered a whole lot of test questions. Passed your state boards. It's April 2020. We all know what the signs and symptoms are. Maybe we don't know all of them 110%, but you work in healthcare, so stop playing with me. You can watch the news. You can listen to your governor, your president, the man on the moon, the man under a rock. We all know general signs and symptoms of this disease, of this virus. Okay, so I go through the listing, and he's very evasive. But then he stumbles and tells me that the patient has been tested and that the results haven't come back yet. Dude, we could have, like, that aggravated me. Then on the flip side, I'm seeing COVID being slapped on a lot of deaths that come through. We don't know that this patient had COVID. I don't know if there's a financial kickback to putting COVID on some of these deaths, but all of these deaths aren't COVID. We're in hospice. Some of them are just the natural disease process. You know, this person has stage 4 or 5 renal failure, kidney failure. You know, they've been declining. This is the natural progression of that disease. But I'm just saying, the stats with the CDC are already messed up because people can't get to the ER. They're dying in their homes. They're undiagnosed. And people are lying in these facilities. People are lying at home to not have the stigma that's attached with COVID. Guess what? COVID is not an STD. There should be no shame. You didn't go out and do something bad. You didn't use drugs in your vein and, you know, you didn't contract the virus that way. Cut it out. And even if you did, in this healthcare field, you're still entitled to dignity, respect, care. I'm just saying. I'm just really irritated right now. So I sent an email to my superior about this because I'm thinking, you need to call this facility and throw your title around and get some clarification and let them know moving forward, this is what we need. Okay? My email gets remixed and forwarded. It gets chopped, screwed, edited, and forwarded to my nurse that is now being dispatched, that is uninformed of the situation she's walking into. And I don't find that to be fair. I will never say where I work at. I will never do that to protect myself. As a matter of fact, I may even post this video well after the fact to protect myself. Like I said in previous videos, I am in nursing school now. I see myself probably going into compliance and things like that because of shit like this. In 9 months, I will be taking my boards, and I pledge to myself that I'm not going to be this person that I see around me. There are some good nurses, awesome nurses. I work with some of them, and there are some nurses that can go straight back to school and start all over again. But that's my feeling on it. And again, I'm not sure when I will post this video because I need to protect myself as far as my financial stability. But that shouldn't overshadow this message that I'm trying to send. So guess what? I'm going to post it now. Have a nice day. Be safe, be informed, and be honest. Like, subscribe, and share. Thank you.